Good afternoon. I am Dr. Neeta Shah from Agarwal Eye Hospital, Chembur, Mumbai. Today we are all here to be talking about cataract, the types of cataract, and the treatment available for cataract surgery. So, for that, we need to understand cataract and we need to understand cataract surgery. So, normally, there is a lens inside our eye which is clear like a spectacle glass, which due to age or some other factors may become hazy, fuzzy, losing its transparency and slowly becoming opaque, which causes a gradual drop in vision, which sometimes the patient may notice all of a sudden if it is in one eye, because normally nobody just closes each eye and checks, and they may come and say that it's only since a few days or a few weeks that I've noticed that one eye is not seen. So, as a patient, I would like to know, how do I know if I have cataract? So they generally describe it as seeing like looking through a fogged up window screen or a fogged up spectacle glass. The vision is, or the eyesight at that time is fuzzy. It is cloudy. Some people may complain that it is difficult to drive. Some people may complain that it is difficult to read. So any difficulty in viewing, whether far, near, should be seen as a cause to visit a doctor, especially if you are 60 years old and older than that. Cataract would be the first thing to come in your mind. But don't wait for it to increase to a level where you can't see. By chance, if you're unlucky and it's not a cataract, the vision loss may be irrecoverable. So you definitely need to go to the eye specialist as soon as you feel there is some disturbance in your vision, which may be of any type. So I repeat, blurred vision, difficulty in doing your day-to-day activities, difficulty in seeing at night, glare, especially at night, the need for extra light to see than what you were needing before, occasional double vision, failing or yellowing of the colors, they're not as bright and crisp as they were before, are all signs that you may be developing a cataract and you need to visit the eye doctor for that and get it checked up. So when do we know that, okay, now I know I have a cataract? When do we come to know that, okay, now it needs to be operated? So think about the effects of this vision or this cataract on your day-to-day life. Can I do the day-to-day work that I was doing earlier without any difficulty? Like, for example, reading, driving, watching television. Is it difficult to cook or climb stairs or shop or look at the medications that need to be taken and take it? How active are you in your day-to-day life? And does this drop in vision or eyesight disturb your activity or affect your level of independence? And you end up needing help of others to carry on with your activities. Are you scared that you may trip or fall or bump into something and have to do things a little more slowly or carefully? These are the signs that you should do the surgery. Delay is of no advantage. What happens is that initially the cataract is like a soft cotton ball. Over a period of time, it hardens and becomes like a stone. So one, there is no advantage in waiting. You're going to make the surgery only a little bit more difficult. Two, other complications may set in if the cataract becomes overripe or it causes raised eye pressure like glaucoma or it bursts. And third, and very important, if you are unlucky and have a fall or an injury, the problems with the bones and joints is much worse and much more difficult to treat than removing your cataract. So it makes sense that you see clear now rather than waiting for an indefinite period, 2 months, 6 months, and see clear at that time. It is definitely not that if you wait, you will get a better surgery, not at all. So once it is detected, all your parameters like blood pressure, diabetes, etc., are well controlled, you should definitely think about doing cataract surgery. So other than aging, sometimes there is cataract because of systemic diseases like diabetes, too much exposure to sun, etc., where the chances of developing cataract are faster. So people who have blood pressure, diabetes, etc., should get a periodical eye checkup done so that it gets up detected and treated in time. Also, things like injury to the eye, a bang to the eye, accidents are causes where you may get cataract earlier than, say, reaching the age-related cataract. So now, okay, I know I have cataract. I know that I've decided that I'm getting the surgery done. All my reports are done. So now, what is done in the surgery? In the surgery, we remove the cataract and put in an artificial lens. So basically, an opaque lens or an unclear lens is being replaced by a transparent clear lens, which gives you back the focusing onto the retina from where we see. So remember, the eye is like a camera. The lens focuses the images onto the film, that is the retina. So if the lens is fuzzy, the images focused are fuzzy. When we replace it with a clear lens, the vision becomes clear. So the various lens choices are basically divided into 3 to 4 categories. The first one is a monofocal lens. Mono means one. In that, if the lens is put for far, you will need glasses for near. The second one is a toric lens. By toric lens, what we mean is if people have astigmatism or a cylindrical power or a number जिसको टेढ़ा number बोलते हैं, where the number is at one axis, we put a toric lens which is placed in that axis so that the clarity because of that astigmatism or टेढ़ा number is restored. So how does it work? It works by seeing that everything gets focused on the retina. You can get monofocal lenses with toric lenses done if you have a cylindrical power. Suppose we don't do it. Then after the surgery, you may need that tiny cylindrical power to be added in your spectacles for far and near. Now, what if someone says that I would like to avoid or not wear glasses? So for that, we have 2 types of lenses. One is trifocal. Tri means 3, where you see far, intermediate, like say computer or laptop, and near, which is like looking at the newspaper or a book. The other one is an extended depth of focus lens, which extends or stretches the depth of focus of viewing. So let us first talk about the trifocal lenses. The trifocal lenses are lenses which allow you to see far, intermediate, and near. Earlier, we used to get the bifocal lenses. Now they are more or less given up because the intermediate distance, which is our computer, mobile, etc., is important for everyone. So in this, there is 1% chance of getting a tiny number to be used occasionally. 99 of them would not need it. And even if they get a number, it's not a big number and they would not need it all the time. There is one small characteristic or disadvantage of this lens is if you look at a point source of light, in this lens, it spreads a little bit. So people who are habitual night drivers or their profession is such that they drive at night need to be cautioned that they may find it difficult to do it if they opt for a trifocal lens. The other lens where you can see far and near both are called the extended depth of focus or the EDOF lens. Here, there are no rings. It is that the zone gets stretched to allow distance and intermediate, which is your computer or mobile viewing. But to see very tiny things, you may need a small number to be used, and 13% of the operated patients would need it, 87 would not need it, but they are cautioned for that. And here the light around a point source of light does not spread. So depending upon the patient's lifestyle, activity, etc., they may want to opt for this particular lens. So this is the extended depth of focus lens, the trifocal lens. In case a patient has a cylindrical power, in both these lenses, the trifocal and the extended depth of focus, we get toric lenses also. It is very important to fit the right lens to the right personality, the right activity that the patient has, and the right measurements of the eye that we are operating on to give a good result and a patient who is happy. So there are some things which generally I get asked is, one is that can both eyes be operated together? So yes, it can be done, but we prefer to do one eye today and the other eye in the next 48 to 72 hours, because we don't want the patient to mentally, physically get subjected to a surgery for both the eyes. It is a stress for them. And that almost nil element of risk is also there. So we prefer that we keep a 48, 72 hour gap. Not that it's mandatory. In certain selected cases, for genuine valid reasons, we may do it simultaneously too. What is done on the day of the surgery? So it is commonly performed by instilling drops in the patient's eyes, which make the eye numb. Duration generally lasts 10 to 15 minutes, and the patient comes out of the operation theater, has a cup of coffee, understands the post-operative treatment regimen, and goes home. You may be asked to wear a protective glass or an eye shield after surgery, and medications are prescribed. Very rarely we may have to give an injection. Because of modern cataract surgery, we generally don't need to give an injection, but yes, select cases where the patient can't focus. I'm sorry about that. So if there are patients who can't hear properly or can't understand the language properly or who can't focus on the light or who have some other complications in the eye or the cataract is overripe, we do give an injection to anesthetize the eye because we cannot see to keep the eye still when we are doing the surgery. So that is about the anesthesia used. The post-operative medications may be in the form of antibiotics, orally and in the form of drops, some mild steroid or anti-inflammatory eye drops, some vitamin tablet, because mentally they do feel a little drained because of the stress of having gone through a surgery. They were never called a nil by mouth. They are not kept starving. They can eat or drink normal food immediately after the surgery. And then they come to show us the next day. And we then call them after a week. And in few cases, we may call them up after a month to come back for a checkup. So this is an overview of how a cataract surgery patient comes to know that he has cataract, visits the doctor, what are the tests done, and goes for surgery. So when you come to us, how do we decide which lens is for you, what should be done? So in our centers, we have the state-of-art Carl Zeiss IOLmaster 700, which is one of the world's most accurate machines to take measurements of the eye to get the lens power. It also tells us whether you have a cylindrical power and whether you need a toric lens. If needed, the retina is screened with the Cirrus OCT, again a Carl Zeiss machine, which tells us whether the area behind the cataract is grossly normal or not. Very rarely, especially in diabetics, we come across some diseases of the retina which are seen by us, where we tell them that it needs to be treated before we do the cataract. Otherwise, the cataract surgery can aggravate the problem. And also, sometimes we may tell them that they are not good for the trifocal lenses or EDOF lenses because it may interfere with the abnormality already present in the retina and cause a lot of jumbling of the vision. It's okay to wear glasses, but it is not okay to have distorted, jumbled vision because the lens surgery or cataract surgery is not like wearing a chashma that if you're not comfortable, you change it and go in for another one. So that is why your discussion with your doctor after the A scan or IOL master and other required scans are done regarding what is suitable for your eye. And of course, what is suitable for your budget is what you should proceed with. So now I am okay to answer any questions that you may have regarding cataract surgery. So sometimes people come forward and ask us, Doctor, how much can we wait? That is something we can answer by looking at the cataract, looking at the general condition of the patient, and giving them a time period where they can wait, or telling them no, they should not. They should get at least one eye done. And otherwise, if it is not a very mature cataract, we tell them you do it anytime in the next 6 months. And if for whatever reason you're unable to do it in those 6 months, come and show us after 6 months to reevaluate whether you can still wait more or you should go in for the surgery. So one of the questions I'm asked is, I got a black floater in my right eye last 2 months. Any remedy for it? So floaters are inside the eye, not related to cataract. So basically the eye is a ball of jelly. And when the solid and the liquid of the jelly separates out, the solid floats around like a floater. There is no medicine which can take it away. There is no tablet which can take it away. Very often it may settle down on its own. Very rarely floaters may be because of a retina problem. So once your retina is checked and you are told that the retina is fine, the floaters, you need to live with it. We say F for floater, F for friends, make friends with the floater. They will not harm you, but they may not go away. But they will not trouble your eyesight in any way at all unless you start looking for them and noticing them. That is when they may end up irritating you a bit. The next question is, I am having a polar cataract. Can I go for surgery as I don't have much vision loss, or do I wait? So polar cataract is a cataract which is a little sticky in the sense there is an anterior layer and a posterior layer. The posterior layer is left behind and we place the lens on that. A polar cataract sticks to this. And very rarely it may come out with this, not allowing us a choice of the lens to be used because the support is the posterior layer. So we have a way of checking whether a polar cataract needs surgery or can wait. We shine a light from the side and ask the patient to see. So what we are doing is we are simulating a condition where a strong light comes into the eye or he goes in the sun. If they can see and read the chart, the distance and near, they can wait. If they cannot, there is no advantage in waiting. It will become more and more sticky and more difficult to take out. The next question is, how do I determine if I am a correct candidate for surgery? As I said, your day-to-day lifestyle, how much it is affected, and how much time is your eye specialist giving you. Is he saying it's okay to wait? Is he giving you a few months? Or he saying you should do one eye fast? So these are the ways in which you would make out how long you can wait or not wait. But I repeat, there is no advantage in waiting. I would look at it this way, that if I do it after 2 months and see clearly, why not see clearly from now? So the frequency of eye checkup at the age of 68 years, that's the next question. Should be once a year if you are not a diabetic, and once in 6 months if you are an uncontrolled diabetic. Otherwise, once a year is good enough. So the size of the eye does not change after cataract surgery. And is there any age band for cataract? No, there are some babies born with cataract also. And I'm sorry, but you may not get it, but you can't escape from it by doing something specific. What age does cataract start building up? There's no fixed age, and it should be treated when it starts affecting the vision. Means even with the glasses, the eyesight is not normal. They are seeing less than normal. So the next question is, what is the difference between advanced cataract surgery and normal cataract surgery? Very frankly, I don't know what you mean, but what we do and what is done all over the world is phacoemulsification, where you make a tiny opening in the eye, go in with the machine, remove the cataract, have a foldable lens which folds and goes in and opens up inside the eye. There is also a femto laser which does not remove the cataract but which does the openings for the cataract with the help of laser. So surgery with phacoemulsification would be the safest surgery that is to be done, increasing the longevity of the result of the surgery for the patient. A patient who has had BP, blood pressure, and stroke, or even other things like a renal failure on dialysis, diabetes, etc., can be taken up for surgery, should be taken up for surgery, but after getting a fitness report from the consulting physician, after all the blood tests, cardiogram, etc. are done, because the physician who's treating the patient is an expert to tell us whether we can proceed with surgery. And because we don't give general anesthesia and we just put drops or give a small injection and do it, once the physician knows that the patient is for cataract surgery, they treat the patient, get all the parameters under control, and then we take up the patient for surgery. So once the fitness is there, patients with BP and stroke can also be operated on. There is no known medication or treatment to prevent the development of cataract except trying to have a healthy lifestyle, not too much exposure to direct sun, and also to try and see to it that if you are a diabetic, hypertensive, renal problem, that it is all kept under very good control. How do you know you have cataract? You can know that you have cataract by having fuzzy, blurry vision. Some people say that I end up cleaning my glasses all the time because I feel it's all fuzzy and I feel it is my glasses. Some people say that I need extra light when I'm reading. And some people, it is a family member who notice that now they are not walking around and all so confidently as they were doing in the past. But the best way is to go to your eye doctor and tell you why this problem is there, whether it is cataract or it is some other age-related problem in the eye which would need treatment other than for cataract. I think I have covered up everything. I am Dr. Neeta Shah from Agarwal Eye Hospital, Chembur, Mumbai. And anything, I'll ask these people to share our email ID, or you can come across to the Medibuddy, and they are very good at helping out patients connect with the correct doctor in their area. and looking after them very well. Thank you so much.